SEO Training Engagement Specialist here at Eventide. I'd like to thank you for joining us. Today I am joined with Kim Nicholls, Director of Clinical Services at Eventide. Thank you for joining us, Kim.
Thank you for having me.
Yes, on the minds of everyone these days is COVID-19. And I'm wondering, can you share with us, what is COVID-19?
So COVID-19 is a new strain of virus that originally started in China. And this particular strain originated in animals and has now been transferred over to humans. This strain of coronavirus is very contagious, which is why the governments have been so active in trying to prevent the spread of the virus. We know that this virus is spread from person to person in two ways. The first way is through contact. So if an infected person comes into contact with an inanimate object, like a doorknob, they can actually leave that virus on that doorknob. So when a healthy person comes behind them and touches that doorknob, they can actually transmit or transfer that virus to that healthy person. The other way that we know the coronavirus or COVID-19 is transmitted is through droplet. This typically occurs when an infected person coughs, sneezes through droplets of saliva or discharge through their nose. Symptoms for people with COVID-19 or coronavirus present like influenza and many other common winter ailments. So the top symptoms are cough, fever, shortness of breath, but other symptoms that we can see are body aches and fatigue. So it's really hard to differentiate coronavirus from other winter ailments. And since this is a new virus, there are many things that we don't know, which is why it's so important to make sure that we're obtaining information from reputable resources like the CDC.
Well, you bring up the CDC, and I think it's so important for us to talk a little bit about that, because there are so many news sources out there now, and some of them aren't so accurate and some of them are, and then some of them try to put the fear factors within us. And so you think CDC is a great place for our general public, but then our employees and residents, everyone to turn to?
Yep, I think they're probably one of the best places we can go. Because it is a new virus, we don't know a lot, and so they're always doing research, and they kind of are that one-stop shop where everyone reports into, and so they're able to disseminate the information and provide accurate information. We don't know the full picture yet, but they are able to provide us some clarity on questions.
Right, and like you mentioned, things are changing on an even day-to-day basis on what we know to be true and the precautions to take. What are we doing at Eventide, the precautions that we're taking right now?
Yeah, so we've actually implemented quite a few interventions to help keep staff and residents safe. And it started about a few weeks ago now. The first thing that we did is we tried to reduce the number of entrances into and out of the building. And so that's really just to make sure that we're restricting people as much as possible. When people do go to those doors that are open, we're going to be screening everybody who comes in. So we're asking visitors to stay away for social visits at this time. And if people have to come in or have a need to come in, we will be screening those people. And when we screen them, we take their temperature, we ask if they're having symptoms like cough, shortness of breath, and then we are also asking if they've had any sort of exposure to a COVID positive person or someone who's being checked for COVID. We're also increasing the amount of cleaning that we're doing within the facility. We're a 24-hour building, and so there's lots of things that need to be cleaned, and so we're tackling that on a day-to-day basis. We're also requiring all staff to wear a mask. Going back to one of the modes of transmission is droplet. And so we know that this can happen even when people are just breathing. And so really trying to keep everybody safe.
Right, and the fact that everyone's wearing masks now isn't the fact that everyone's sick, it's the fact that we're trying to help protect as best we can where we're at right now with what we know.
Absolutely. And along with that too goes an educational component. So making sure people know why we're doing the things that we're doing is so important, and really trying to emphasize those preventative measures like cough etiquette, washing your hands, those sorts of things to make sure that we're keeping people safe.
And you talk about cough etiquette, and there's things over the years we've heard, people used to cough in their hand all the time, and now the cough etiquette, if I'm correct, is to cough in your crook of your arm. Is that correct?
That is correct. Just because there's less contact with that part of the area with other things. And then also a tissue can be used as well, but then dispose of that tissue immediately and then perform either hand hygiene, whether it's hand washing or hand sanitizer, to make sure that you're cleaning your hands after that.
and avoiding touching your face. I've heard people say it's like, oh, it's no big deal, don't touch your face. But then how many times do we touch our face or touch our hair or rub our nose? It's several times a day, I think I've heard.
Yeah, so the mucous membranes, which is your eyes, your nose, your mouth, they're a great portal into the body. And so we're really trying to discourage people from touching their face because we know that your hands are going to pick up different things throughout the community or throughout the day or in your house. So really trying to make sure that we're keeping ourselves as safe as possible.
Mhm. And something else you talked about just a moment ago is the residents and being there for them. And something that's been amazing to us to see is how supportive the families have been on, because there are those restrictions and it's so hard to not be able to go in and see your family on a day-to-day basis for some people. And so tell us a little bit more about the precautions that are made about people being able to come in and have access to inside the building, because isn't it true that one of the safest places to be is one of our communities right now because of the restrictions?
Yeah, so the long-term care facilities really across the state of North Dakota and Minnesota have been restricting visitors for a long time, and Eventide is included in that for several weeks now, really just trying to reduce the number of people coming through the facilities, because we know if we decrease that number, the risk of getting COVID or coronavirus in the facility is reduced significantly. And so we're really just trying to keep the safety of staff and residents at the forefront at all time. And we understand that it's a difficult time for families to not be able to come in and see their loved ones whenever they want, much like they had been doing. But really making sure that we're trying to be as supportive as possible with what we're doing and really helping bring that safety feature up to the forefront and try to keep people safe.
Great. Well, it has been fun to see all the different creative ways that people are connecting with their loved ones. And so that's been really touching to see in those times. And what's really also been amazing is to hear how the families have been reaching out to their loved ones that are living with us and sharing with them, not trying to scare them, but trying to reassure them. Can you share with us some ways that people can reassure their loved ones that of what is going on? Because it is a confusing thing to understand.
I think the most important thing that you can do is just try to be calm when you're talking to your loved one, and know that we're taking every precaution possible to make sure that we're keeping people safe, and accept some of those alternative methods of visits. So I've seen people come and visit through the window, and I know that we have video messaging or video chats, video calls that families can get signed up for so that they can actually see their loved one and have conversations with them.
And I know that if a family member or a loved one would like to connect with someone in a certain way, all they have to do is call the campus, the campus that they're at, because that different protocols or things are set up for each campus.
Yeah, so they just need to reach out to their campus and they'll help coordinate a video visit with their loved one, so they can actually see and talk to them.
Mm-hmm. That's wonderful. Now, are there any other last things that you'd like to share with us before you go today?
I think the most important thing is just to know that it's a safe place, and we really are encouraging people to keep themselves safe when they're at work for employees and when they're at home too. So making sure that you're doing your hand hygiene, your cough etiquette, and really just trying to keep safety at the forefront of your mind at all times, because it's very easy to get this virus. And so we just are trying to take every precaution possible.
Well, wonderful. Thank you.